Hello, my name is Sean Ritchie, and I'm here to talk to you about my perspectives on religion in healthcare. In the medical care setting, maintaining a professional approach to religion and religious patients is crucial for providing respectful and effective care. Here are 10 key principles I feel are important to consider. Number 1 is respect for diversity. Recognize and respect the diversity of religious beliefs and practices among patients. Avoid assumptions based on appearance or background, and instead ask patients about their beliefs and preferences regarding medical care. Point 2 is non-discrimination. Provide care that is non-discriminatory and inclusive of all religious backgrounds. Treat each patient with dignity and respect regardless of their religious beliefs or practices. Number 3 is understanding beliefs. Educate yourself about common religious beliefs and practices that may impact medical care. This can include dietary restrictions, fasting practices, preferences on prayer or religious rituals, and beliefs about illness and healing as covered in the text for this class. Sensitive communication. I believe it's important to use sensitive and respectful language when discussing religious beliefs. Avoid imposing personal beliefs or assumptions on patients. Allow patients to express their beliefs openly and listen attentively without judgment. Accommodation of practices. Whenever possible, accommodate religious practices that do not interfere with medical treatment or compromise patient safety. This may involve things like scheduling procedures or medication administration around prayer times or providing a space for religious rituals. Expand your care team by consulting with spiritual care providers. In cases where religious beliefs significantly impact medical decision-making or emotional well-being, it should be a consideration of all healthcare providers to maybe involve a chaplain or spiritual care provider who are trained to support patients' religious and spiritual needs. Privacy and confidentiality. Maintain strict confidentiality regarding patients' religious beliefs and practices. Ensure that discussions about religious matters occur in private settings to protect patient privacy. Ethical considerations. Navigate ethical dilemmas related to religious beliefs with sensitivity and adherence to professional ethics. If needed, seek guidance from ethics committees or consult with colleagues when faced with complex ethical situations, remembering, of course, to adhere to HIPAA law. Cultural competence. Develop cultural competence that includes understanding religious diversity. This involves ongoing education and self-awareness about one's own beliefs and biases. And finally, documentation. Document relevant information about patients' religious beliefs and preferences in their medical records, ensuring this information is used appropriately to guide current and future care. By integrating these 10 principles into your practice, you can create a supportive and respectful environment for religious patients, enhancing their overall healthcare experience while upholding professional standards. When discussing religiosity with patients, emphasize a patient-centered, empathetic approach aimed at supporting individuals in exploring their religious and spiritual concerns. Rather than directing the conversation or imposing interpretations, nurses are encouraged to maintain a non-directive stance, allowing patients to express their thoughts and emotions freely. This approach fosters a therapeutic environment where patients can delve into how their religiosity intersects with their health and well-being, potentially leading to greater self-awareness and problem-solving. Nurses are advised to focus on the patient's current experiences and feelings, rather than factual details or future implications, thereby supporting healing and addressing religious distress in the present moment. Moreover, effective communication about religiosity involves acknowledging and respecting the patient's language and terminology regarding their religious beliefs. Nurses should reflect the patient's use of religious terms and avoid imposing their own religious perspectives or assumptions. Whether responding to factual discussions or emotional disclosures, nurses should tailor their responses accordingly, responding with factual inquiries or empathetic reflections based on whether the patient is engaging from a cognitive or perhaps an emotional standpoint. This patient-centered approach not only enhances therapeutic rapport, but also upholds ethical practices by honoring the patient's autonomy and facilitating meaningful discussion about the role of religiosity in their life and health journey. These are my perspectives on religiosity and providing care in hospital settings with a focus on religion from patients. Thank you for your time.